my name is Kevin. I'm from London, UK. I'm really happy to take my new voice.
My problem started when I was 12 years old.
This will definitely motivate people who are suffering from similar situations.
I have high pitch voice problem.
तो अभी तो सर मेरे को बहुत अच्छा लग रहा है, वॉइस में काफी फर्क आ रहा है.
Okay. I actually had this surgery in the back and
You said, I'll take it as a challenge and I'll give you your voice back without any invasive procedures.
After surgery, I have vocal cord paralysis. And now I can speak normal. I feel good.
Hi, I'm Cyrus. Hi, my name is Cyrus.
Hi, I'm Chong. Now my voice has recovered and improved.
इससे ज़्यादा बेहतर महसूस कर रहा हूँ.
My name is Shirajuddin from Warnal.
And I'm very happy that I'm speaking like a normal people with a bass voice like male.
So I'm having this voice problem. I spoke with a few of my friends and they found reasonable changes in my voices.
I've been facing difficulty in speech. You are able to speak words properly and sentences properly.
Just you try to say something.
treatment the same day. After 2 hours I got my voice.
Hello friends, welcome to our YouTube channel SLP Sanjay Kumar Voice Therapist, and today we are live with Clifford, and today we are before treatment live, and today date is 15th of July 2021, and my name is Sanjay Kumar. By profession I am a speech language pathologist and audiologist, and my area of interest is treating voice disorder. And so today we are with Clifford and who is having some voice problem. नमस्कार दोस्तों, आज हमारे YouTube चैनल पे आप सभी का स्वागत है. मैं हूं आपके साथ SLP संजय कुमार वॉइस थेरेपिस्ट, और मेरा एरिया ऑफ इंटरेस्ट है वॉइस डिसऑर्डर का ट्रीटमेंट करना. और आज हम लोग क्लिफर्ड के साथ ट्रीटमेंट से पहले लाइव हो रहे हैं, और आज डेट है 15 ऑफ जुलाई 2021, और भविष्य में हम लोग ट्रीटमेंट के बाद भी लाइव होंगे. तो हमारा यूट्यूब चैनल सब्सक्राइब कर लीजिए और क्लिफर्ड का पोस्ट ट्रीटमेंट लाइव भी जरूर देखिए. Clifford, I want a speech sample. Like you can tell about yourself, why you contacted us, what problem you are facing, where you stay, and why you contacted for online voice therapy.
Hi, my name is Clifford Cardozo, and I'm 34 years of age from Goa. I have this high-pitched voice from a very long time now, and I also cannot talk loudly. I find it very difficult to talk loudly, especially in noisy environment. And I came to know about you when I was doing some research on YouTube. So I got your videos.
Okay, thank you. And so those who are in this live, please be connected with us. In this live, we are going to talk about the different voice problem and what are the causes of such problem, and what we are going to do in the voice therapy, especially in the case of Clifford, and we'll be correcting him online voice therapy. So what exactly we do in the online voice therapy, on those point also we'll be discussing. And so Clifford, have you contacted any professional before contacting me for the solution of your problem? Can you tell me?
No.
Okay, fine. So only you tried to correct through the voice therapy, or you just recently came about to voice therapy, or some today discussing about something? Hello?
The one ENT surgeon. Can you hear me?
Yeah, I can hear you. Please go ahead.
I consulted one ENT surgeon long back. He told me that there's only one option, and that is surgery. And he was also not sure whether he will be able to get. He said that you can lose your voice. That's what he told me. So I was very, very disappointed. But now I have some hope in you.
Okay, so you want to say that you have not taken any other places the treatment, but you contacted for the other professional and they suggested for the surgery. Yeah, I got it.
Yes.
Okay, and so what are the challenges you are facing in day-to-day life due to this voice problem?
Well, firstly, it lowers your self-confidence, and this thing is normal. And when you see that you cannot do a normal thing, then it is really disappointing, especially when singing or talking loudly in a noisy environment. So it's very challenging for me.
What is your profession?
I am a seafarer, working in merchant navy.
Okay. Okay, so I'll be talking about what are the causes of such problem, and we'll be also talking about some other communication disorder. So those who have joined this live, I want to say thank you for everyone. And to understand this problem, let's first understand how the normal speech production mechanism, and then we'll come to the different disorder, including Yost disorder. For normal speech production, first thing is the thoughts that comes in the brain. And then we take air, that air goes to the lungs. When we breathe out, we put air pressure below the vocal cord. Here we have a larynx. Inside the larynx, we have two string-like structures known as vocal cords. So once you put air pressure below the vocal cords start moving like a string of a violin and guitar, and sounds generate. Then we modify that sound into different sound with the help of our lips, tongue, jaw, teeth, palate. For example, if you want to say po, both the lips are coming closer together and touching each other. When you want to say ta, tongue is coming between the teeth. When you want to say ka, back of the tongue is getting elevated and touching the soft palate. So each and every sound has own place, own manner of articulation. So suppose you say a one sentence, so many things happen at a time. Thoughts come, we take breath, we put air pressure below the vocal cords move, sound generate, we modify that sound into different sound. In one sentence, there are so many words. In each word, there are so many sound. Each sound its own place, own manner of articulation. So it is a little complex process. In this process, hundreds of our body muscles work in a very, very coordinated way. If coordination among these muscles goes, fluency goes. That can be seen in case of a stammering. Of course, you are not having a stammering or a stuttering or जो हकलाने की समस्या होती है. But I'm just for awareness I'm talking. And when place of articulation and manner of articulation will be wrong, there will be pronunciation problem. For example, for ta production, tongue should come between the teeth. And if somebody is not bringing the tongue between the teeth, the sound will be something different. So those who are having the pronunciation problem, they may be using, I think, wrong, manner of articulation or place of articulation or both. So in articulation therapy, we teach the place of articulation and manner of articulation, or sometimes it's both. And sometimes articulation problem can be related to the hearing issues also. So we do the hearing evaluation also before starting the treatment in some cases. And of course, I'm a speech language pathologist as well as audiologist, and my area of interest is treating voice disorder. And so I was talking about like how the normal speech production mechanism. Let's come to the point where we can see the high-pitched voice or feminine voice. So the all high-pitched voice, feminine voice are not exactly the same thing. Sometimes nature will not give sufficient mass and the length of the vocal cords. So we call the condition sulcus vocalis. That time also it can be seen like a high-pitched voice. Sometimes there will be phonatory gap, muscle tension, dysphonia. In that case also the pitch will be higher and voice will be feminine. Sometimes vocal cords will be normal, and that time also if the patient is not using his vocal cords in a more effective manner, that time also the pitch will be higher. So as you told earlier to you, the ENT surgeon suggested you for the surgery, but sometimes like awareness is less among the doctors also. This problem can be treated by the voice therapy. So I'll be correcting this problem by the voice therapy, or in fact by online voice therapy. I'm in Bangalore, you are in Goa. And those who are watching this video, please subscribe our YouTube channel and don't forget to watch the Clifford post-treatment live as well. And that we'll be doing in future, maybe most probably in 2 weeks, or within 2 weeks we'll be doing, and sometime before also. And so why the problem of high-pitched Clifford is happening? So based on my acoustic analysis and other evaluation, his vocal cords are normal. So what happened during puberty, the mass and the length of the vocal cord increases due to a hormone called testosterone. So when mass and the length of the vocal cord will increase, the pitch reduces. Here we have larynx. Inside the larynx, we have two string-like structures known as vocal cords. So during puberty, the vocal cords of boys and girls, they will not be having much difference. They both will be the thin and the pitch will be higher. But during puberty, in case of boys, due to a hormone called testosterone, mass of the vocal cord, length of the vocal cord increases and the pitch reduces. You can also understand this mechanism with the guitar string. Before puberty, the vocal cord will be thin. So it will be like a thin string of a guitar. After puberty, due to testosterone effect, the vocal cords become thick. So it will be like a thick string of a guitar. So when the guitar string will be the thin, the pitch will be higher, the voice will be shrill. But when the guitar string will be thick, the pitch will be lower. So before puberty, that's why the boy's voice will be high-pitched voice. But during puberty, mass of the vocal cord increases, length of the vocal cord increases, the pitch reduces, so it's become more masculine. But after seeing to you and my other evaluation, you don't have hormonal issues. And then why the pitch is higher? Because from childhood to puberty, you spoke in a high-pitched voice. During puberty, due to the testosterone effect, mass got increased, length got increased. I'm talking about the vocal cords. Vocal cord mass got increased and the length got increased. So now your vocal cord was ready to produce the low-pitched voice during puberty. But because of so many years habit, from childhood to puberty, you spoke in a high-pitched voice. So you have not accepted the change which has happened during the puberty. Means during puberty, your vocal cord was ready to produce the low-pitched voice. But because of so many years habit, you continued your childish voice. You were not able to switch on to your new low-pitched voice, which should be ideally, depending upon the vocal cord mass and the length. So what happened during puberty, your mass and the length of the vocal cord increased. So now the vocal cord is like this. But to maintain the childish voice, because of the so many years habit, what you started doing, to vibrate only thin edges of the vocal cord. So actually your vocal cord was thick, but you started using your vocal cord like a thin string of a guitar. And when guitar string will be thin, the pitch will be higher. So what I will do as a voice therapist, I will try to stimulate whole mass and the whole length of the vocal cord. So now it is vibrating thin edges, and after my therapy, whole mass and the whole length will be start vibrating in effective manner. So the vocal cord, which was behaving like a thin string of a guitar, now it will start after treatment, behave like a thick string of a guitar. So when guitar string will be the thick, the pitch will be lower. So I'm not going to replace your vocal cord or larynx. What you have, I'll be trained you to use in a most effective manner. Sometime I get calls, some patient on my reception, they will say that, and sometimes I also speak to the patient for the perceptual evolution. So they will say, sir, I have seen very impressive voice of a XYZ patient. I want voice like him. So friends, to get the voice like him, your vocal cords should be